Okay, again, welcome everyone. Today's Ask the Expert topic is effective treatment for women and girls with ADHD, something our center is very well known for because of who I am with today, Dr. Kathleen Nadeau. She is the Chesapeake Center's founder and center director and a world-renowned expert on ADHD. She founded our center over 40 years ago with the vision to provide multidisciplinary, transformative care for individuals and families impacted by ADHD. She received her bachelor's, master's, and doctoral degrees in psychology at the University of Florida, and she's been considered a thought leader in the field of ADHD and is most recently a pioneer in researching and writing about the needs of older adults with ADHD. She has authored over a dozen books on ADHD, including Understanding Girls with ADHD, How They Feel and Why They Do What They Do, and Understanding Women with ADHD, which is actually something that she's working on coming out with a new version of that based on new research and such. And her pioneering work on girls and women with ADHD earned her the Chad Hall of Fame Award, among other accolades. Without further ado, Dr. Nadeau, welcome.
Oh, well, I'm really happy to be here. And as you can all imagine, this is one of my favorite topics in the world to talk about. I am a clinical psychologist. I've had this specialty clinic for many years, but I think my strongest credential is that I am a woman with ADHD, the mother of a woman with ADHD, the grandmother of girls with ADHD, the sister of a woman with ADHD. I have lived every aspect of it. And if you met all of us, you would see that we're very, very different from one another. So before I get started, because in this part of my presentation, I'm talking about girls, I would like to know how many of you are mothers with a daughter with ADHD that brings you here, and tell me whether you yourself have ADHD or you do not have ADHD but are raising a girl with ADHD. Um, the reason I bring that up is it's a very different experience having ADHD yourself. It can bring real pluses and minuses to the experience of raising a daughter with ADHD. Number one, you certainly have a better understanding of where she's coming from. But number two, you may experience some of the same difficulties and frustrations that your daughter is experiencing. So maybe we can talk more about this in the Q&A after I rush through my information-rich presentation. Please don't frantically take notes. I am welcome to share these slides with anyone that would be interested in seeing them. So let's jump in and get started. So there's a huge ongoing underdiagnosis of girls. I think we all know that. And the diagnostic criteria are still the criteria that were developed to best identify boys. That's a huge problem. It's an ongoing discussion in the field, but we haven't gotten there yet. So how do our daughters differ? Well, they're less likely to be hyperactive. And if they are hyperactive, it's very often that they're hyper talkative rather than physically hyperactive. They're less oppositional and aggressive than the boys. And they are also emotionally hyper reactive, whereas boys and men certainly may have difficulties with anger management. I would say girls and women are challenged with just general emotional hyperreactivity, that we can become very upset, very frustrated, very anxious, very excited, very happy. If you can describe an emotion and put very in front of it, that's what a lot of us females are. Girls tend to hide in plain sight, hiding from their teachers, which is why very few teachers identify them. Just as a side note, I don't have time to talk about this, but I have developed a questionnaire to help teachers identify girls in the classroom. And I'm going to be distributing that to a lot of schools in the area. So girls with ADHD are absolutely not all alike. And Patty Quinn and I, my longtime writing partner, came up with some of these little nicknames of Tomboy Tara. These are the most physically active, the most like the boys. They may be willful, strong emotions. They may have more learning disorders. And often they're very athletic, competitive, more risk taking. And some of these girls find a great place to grow up in some kind of athletic activity. Chatty Cathy. I was well named by my parents. I was absolutely a Chatty Cathy. The reason I learned my math facts was that was the punishment for talking too much in class, was to write your math facts over and over. So at least she gave me something constructive to do as my punishment for talking too much. Chatty Cathys often overlook details and may blame others when they keep missing on details. They can be bossy, sometimes stubborn, definitely out there compared to shy Samantha. We have a shy Samantha in our family too, and they are daydreamy, a lot more passive, lower energy, tend to protect themselves by just staying away if they can't keep up with all the social rough and tumble that girls go through, and may seem almost hypoactive at times. Then there's emotional Emily. And this is absolutely not a recognized subtype in the DSM, but what we're beginning to realize is that emotional dysregulation is really a core symptom of ADHD, especially in females, but it's not there yet. So emotional Emily has a lot of emotional overreactions, um, maybe hypersensitive in sensory ways. And in some cases, but don't worry too much about this, this is not a given. This subtype may be a precursor to developing bipolar disorder. One of the things you moms might recognize or want to think about is very often these emotional Emilys are much more emotional, excuse me, at home and quiet and couldn't be nicer in the classroom, which leads mom to be blamed for it. Well, she's a perfect angel at school. I don't know what's going on with that mom. It's just safer to be an emotional Emily when you're home. So here's some of the things that lead girls to a late diagnosis. If they're inattentive, they're not drawing attention to themselves because they're not bothering the adults around them. If they have a high IQ, they're usually doing really pretty darn well in school, which is not what teachers are expecting. They may have very strong obsessional features, get anxious, work way too hard to perfect their assignments that they're turning in, may get very anxious when they're facing a test. Girls with no learning disabilities are harder to identify. Girls without coexisting conditions such as anxiety, depression, disordered eating patterns are harder to identify. And if girls are fortunate enough to be in a calm, supportive home environment, they may stay in hiding for a long time without diagnosis. But what happens when girls don't get diagnosed? The risks come later. Girls with ADHD, Biederman's study was about cigarette smoking, but now it's vaping. They're at much greater risk. In a way, this is a way to self-medicate with nicotine. Alcohol and drug abuse in high school years is greater. Sexual promiscuity is greater. A lot of these girls, it's a combination of impulsivity and also really wanting to be liked, accepted, and cared about. They're more vulnerable to be manipulated in that way. One of the differentiating factors between girls and boys with ADHD is low self-esteem. Connors in his questionnaires found greater low self-esteem, but it goes back 30 or 35 years that this distinction between males and females has existed. and chronic underachievement. These girls, many of whom are really quite capable if they got the supports they need, are underachieving by the time they get to high school. We need a self-report questionnaire for girls. Why? Because it really is an internalizing disorder. It's like only asking the adults around a girl, is she depressed or is she anxious? We're going to ask the girl, aren't we? We should do the same thing for ADHD. We have developed a self-report instrument for girls, and it is available. It has been published in our book, Understanding Girls with ADHD. Shouldn't be considered a diagnostic instrument because it hasn't yet been validated. So let's go through the age range quickly so we'll have time to talk. Preschool girls with ADHD. Yes, preschool is not too early to diagnose. And I find a lot of moms wanting to put off a diagnosis. Maybe this is just a stage, maybe she'll grow out of it, and later experience real regret. You know, we could have helped her a lot more if we had identified her at a young age. And that young age doesn't necessarily mean going on stimulant medication. There are many things that we can and should do for girls. So what can we do for our preschoolers? It's really important that they not become overly tired or hungry. All kids lose control when they are. Our daughters with ADHD doubles or triples that likelihood. It really helps them to develop reminders, to slowly build routines and really engage them in developing the reminders. Then they can feel proud of it, excited. I've brushed my teeth, I've got on my jammies, I'm ready to get in bed. And this is something they're going to be working on their whole life. How do I develop routines to manage my daily life? And we need to start with them when they're 3, not wait until later. Social interactions may need more supervision. And if you're going to use a timeout because they've been really behaviorally out of control or defiant, use very short timeouts. Do not use timeouts that take them away from your presence, but just a place to sit down, regain self-control, and calm down. It really helps to develop self-calming techniques from a very early age. And kids are very good at learning deep breathing. One thing you can do that kids really enjoy is have them lie on their back, put a stuffed toy on their tummy, and teach them to take deep breaths in and out. You know, make the bunny go up, make the bunny go down. Very effective self-calming technique for a preschooler. And don't worry if you find your daughter being developmentally delayed in some ways. They may wet their pants, have accidents much later than for non-ADHD girls. They will grow out of it. It really is a neurological delay in self-control. So now let's jump into elementary school girls with ADHD. So these are the girls that are still overlooked. The more hyperactive, impulsive ones may seem self-centered when it's not really self-centeredness at all. It's a tremendous difficulty keeping what I'm trying to do in mind and pay attention to all the people around them. So there may be an urgency, they interrupt, they shout out in class because they have the answer and they're afraid they'll forget it later. They may seem to be less aware of the feelings of the kids around them. Some girls of the more inattentive type may even show school anxiety to the point of school phobia. Sometimes they become very hyper focused in their intense attempts to do what the teacher's asking. And Steve Henshaw, a wonderful psychologist out at UC Berkeley, has studied the social interactions of girls with ADHD for years. And what he found is whether they're more hyperactive and boisterous or more quiet and inattentive. Most girls with ADHD have difficulty comfortably connecting with their peers. As he put it, the hyperactive impulsive girls are socially rejected. They're bossy, they're loud, they're butting into our game. And the quiet inattentive types are socially neglected, as Henshaw said, because they just don't know how to join the group and fit in. It's like the social interactions are too rapid and confusing for them. So what can we do to help our elementary school age girls? Help her understand that sometimes her negative behavior is simply attention seeking. It's so critically important. I'm sure you've all heard this term, special time with kids, but for girls with ADHD who are so often forgetting things, losing things, not doing things on time, their daily routine is filled with corrections and criticism, and that makes special time with them even more essential. And special time is really a time when you're not correcting or instructing, you're not trying to get them to get better at something or learn, you're just hanging out with them. It can be absolutely anything that you and your daughter enjoy doing together. It's really important to develop homework routines. And for kids with ADHD, they need breaks. They can't really effectively sit down and do homework for a solid hour without a break. The important thing is to make sure the break doesn't turn into their screen time and you can't pull them back to homework. Very often the breaks, it's helpful to have movement breaks. You know, let's get up and march around the dining room table 5 times and sit back down. It can even be kind of fun. And it's so important. Girls say over and over again, I'm not good at anything. So what I like to tell parents is help them develop islands of competence, meaning something they like and that they're naturally good at, that they can emphasize instead of just thinking of all the things they're not as good at. Just very quickly, I find that teacher selection, if you have any choice whatsoever, is the most critical factor in elementary school, helping them to be understood and supported by the teacher. And this usually has to do with parents developing a relationship with the teacher, not parents demanding that the IEP be supported. Those poor teachers might have 7 kids with 7 different IEPs in the classroom. And I find it's much more effective to take a personal approach. Okay, so here we are at middle school, and this is the dangerous transition. This is one of the most common times that a girl will be diagnosed with ADHD. Why? For several reasons. Number one, she's going into middle school, lots more demands for executive functioning, organization, planning that she's not naturally good at. She doesn't have one safe classroom cohort. She's moving from class to class. And so her social skills are even more challenged. But the big kicker is she's entering puberty. And as we have learned more and more, hormonal fluctuations starting at puberty hugely impact cognition and mood. And so if they were struggling to hang on in elementary school, boy, are they struggling now. Um, they are typically immature for their age, which makes it harder to fit in. They're still dealing with puberty and lots more demands from the world, from their parents, and from the school. The one thing I can say to you as a parent of a middle schooler is make home a safe haven, not another place where people are mad at her because your room is a mess. I asked you to empty the dishwasher and you didn't. I mean, if it just becomes another litany of you messed up again, then life is going to feel pretty miserable for her. I am a huge believer in helping girls develop calm down spots. My younger granddaughter, who is now in high school, um, had her mom put a wardrobe in her bedroom so that her closet could be her calm down space. And she furnished it with pillows and sleeping bags and stuffed animals and soft light. And it really was her safe haven. When the world just got to be too much for her, she had her own special place to go. Um, Peer issues are huge. There are going to be a lot of hurt feelings, a lot of feeling left out. And there may be a real intensification. If you thought she was overreactive in elementary school, boy, is she overreactive now. And it has to do again with hormonal fluctuations. This is a good time to help her and you start tracking her menstrual cycle so you and she can both say, no wonder I'm so upset. This is my premenstrual week, and things will probably feel a lot better in a few days. Kids are going to need a lot of support to do the things that other middle schoolers can do with relative ease, like long-term school projects, getting specialized tutoring in academic areas. And this is not necessarily something that can be supplied by the school, and helping her with organizational skills. I mean, I remember vividly one mom said, we just dig out her backpack the minute we're both home and get out the banana peels, get out the lunch, get out the permission slips that are, wadded in the bottom of her and get her reorganized for homework and the next day. It's a great habit to develop. So lifestyle changes, I wish I had another hour to talk to you about all this, but it's so important. Diet, exercise, sleep, all have a huge impact on her mood and on her cognition. And this is the time for her to start being aware of that and not having it be something that her parents nag her about, but something that's coming from the inside that I can help myself. And now we get to high school girls with ADHD. Things get more complicated. Women with ADHD have many, many coexisting conditions, and usually they begin to pile up during high school years. So depression and anxiety, yes, there are younger girls that have depression and anxiety, but it intensifies in high school. Self-esteem is even a greater challenge. The high school years are hard for all of us to navigate, but even harder when you're a girl with ADHD. And so the feeling of overwhelm and where do I fit in, and making impulsive mistakes with boys, with alcohol, with trying to find a place where you feel included and accepted. The anxiety and depression and disordered eating patterns we see a lot of in girls with ADHD begin in high school years. So compared to boys, there's more anxiety, depression, and when this is psychology speak, more external locus of control, that all that basically means is I'm not in charge of me and my life. Things just seem to happen to me. So girls in high school don't need so much behavior management as need to understand their differences and begin to appreciate their very real strengths. I think one of the sad things about the way we approach ADHD is we just look at what you have trouble doing rather than this kind of brain also makes me funny, spontaneous, creative, high energy, things that can become very good traits in the right circumstances. There are a lot more mother-daughter issues between girls with ADHD and their mothers compared to boys. Peer issues we've already talked to. And self-esteem and shame begin to become very real issues. So just a reminder, catch her being good. In other words, find ways to emphasize the positive help her build those islands of competence, and make home a safe environment where she can retreat from the world and recover and recuperate. So here's my wish list. If I had a magic wand, we would have better diagnostic criteria, so we're not diagnosing girls in middle or high school or college or beyond. We need use of self-report questionnaires to better diagnose them. Um, we need to be more accepting of behavior that isn't sugar and spice and everything nice. A lot of girls with ADHD are messy or sloppy or forgetful or loud or reactive. And yes, we have to find a way to fit in the world, but we also need to help our daughters find places that are more natural fits for who they naturally are. And and I close with, we want to help them not sit down and be quiet, not sugar and spice and everything nice, but learn to stand up and be heard, help them advocate for themselves and their needs. Okay, and I am going to stop right there and take some questions.
Okay, wonderful. And I've been monitoring the chat and I'm trying to group the questions in the best way possible and try to get to as many of them. But I'm going to kind of start with some of the common ones that I received. What are your thoughts about the signs and symptoms of ADHD that overlap with an autism diagnosis? And just
Well,
is that a common, yeah.
that's a very, very general question. So yes, there certainly is overlap in that girls on the spectrum and girls with ADHD both often have problems with social connections and interactions. Um, what I find is that girls with ADHD, and it's almost always the inattentive type that are also on the spectrum, are girls that often live in their heads imaginatively. In fact, some of these girls develop fascinating alternative worlds to live in because that's what the autistic brain often allows us to do, is be very creative and develop alternate realities. One of my granddaughters is both on the spectrum and has ADHD, and she has had this remarkable propensity from the middle of elementary school to develop plots and character and dialogue. And she tells me that that's really going on in the background all the time. She's more interested in that world often than the world that's right in front of her. Um, Now that I hope that we begin to think of ADHD as existing along a spectrum, a continuum, just as we finally come to recognize that autism is, because it used to be that when we talked about autism, we were talking about a very, very challenged, disabled, often nonverbal child. Now we're not talking about that at all. That's one extreme end of a long continuum, with Bill Gates at the other end. You know, there are lots of positive traits associated with autism spectrum. And I think the same is absolutely true with ADHD, but we haven't gotten there. We haven't recognized that it is a spectrum disorder and not a categorical disorder.
Thank you. And I also want to say to everybody, if we don't answer your question here, I'm saving the chat and we will reply with resources and everything after this with the slides and the recording. So don't feel like we're not answering your question. We did get a few specifically about the enuresis. I'm sorry if I'm saying that incorrectly, but yes. And so at what age do you look for factors outside of ADHD developmentally, but also what can help in that situation? Like someone mentioned a bedwetting alarm, or like any advice generally about like how to help with that in terms of the bedtime routine?
Well, one thing I would say is it's really important not to make a big deal out of it. I know it's a pain in the neck to have to change sheets and wash everything, but you don't want to make her feel embarrassed or lie about it or worry about it. Obviously, cut down on drinking before bedtime. Yes, it can help if you wake her up and take her to the bathroom before you go to bed, which hopefully is several hours after she's already gone to bed. Uh, but it really is a neurological delay. I have seen plenty of girls not develop great bladder control until they're maybe in the second, going on third grade. And they'll get there, and the less you make it into a huge problem, the less traumatizing it'll be. It A lot of it is lack of awareness, that girls get so engaged in what they're doing that they don't even notice that they need to go to the bathroom until it's urgent. And so just a quiet reminder, do you want to take a break and go to the bathroom? Girls get very, very motivated to learn not to wet the bed as soon as they get to the age where they might get invited for a sleepover. And then it's on them. They want to stop doing it, and they're going to work with you.
Some of the questions we had were about kind of parenting and as a mother with ADHD, and we are going to get to women with ADHD. So I kind of want to save some of these for that. We also had some questions about women. Um, do you, how do you get a child on board with the backpack dugout? There were a few things about that with like being difficult to implement that. How do you help them get on board with these types of routines?
So it sounds like the mom asking that question is that they don't want you to go through their backpack, or they don't want to bother with it. Um, I think to not make it a big deal, to make it part of coming in the house, and you must be hungry, you want a snack, let's, dump out your backpack and throw away whatever's left of your lunch. If there's anything in there, is there anything you need to give me from the teacher? In other words, don't make it some big forced ritual, but just build it in as a habit, along with other positive interactions of how was your day, and would you like an apple, and we're going to eat in an hour.
And I think Kaylee actually summarized it really well because this was the kind of common theme of these questions was how do you toe the line with resistance to doing things that need to happen? So like hygiene, bathing, homework. If they've tried incentivizing and making things fun, do you have any other tips on ways to help with that resistance?
Well, I would say reward, reward, reward. I remember working with a single mom of three kids, and this was not necessarily nutritionally advisable, but boy, it did work. And she told her three kids, I'm down in the kitchen, I'm making breakfast, I'm, getting your stuff ready to go to school. And the first one down, completely ready, gets some treat, a chocolate donut, a special treat in your lunch that day. And they were racing each other down the steps to be the one that got that. Um, Also, it's so important not to get bent out of shape about it. Um, if there's a way that you can make bath time and shower time more pleasant by listening to music or doing something fun while they're doing it. Kids don't like to be ordered, here's a long list of chores and go upstairs and take a shower and brush your teeth and put in your, and it just feels like they've got marching orders. I think the more that we can do that sort of thing with our kids, the more easily it's going to go.
Okay. And then just real quick, because we also have some clinicians who have asked some questions. And I think, again, the general theme here is what assessments can people use to differentiate between ADHD and anxiety and depression? Do you have any?
Well, sure. And I don't think it's that hard to distinguish. Girls with ADHD often have a lot of anxiety. Uh, it can be a completely standalone associated disorder, but just as often, if not more often, especially with younger kids, it is secondary to the ADHD. In other words, they're always feeling stressed out and anxious because I'm going to screw up. I didn't remember I was supposed to do this. I wasn't able to finish that. It's the anxiety driven by the ADHD. Anxiety does not make you forgetful. Anxiety does not make you leave your pajamas on the floor. Anxiety does not make you get sick of doing your homework. I mean, there are lots of ways to distinguish anxiety and ADHD, even though that they so commonly coexist. And I think as psychotherapists, we're just so much more trained to recognize and treat anxiety that that's the first thought that hops into our head. So when we're thinking about girls, ADHD is so highly genetic that the first question out of your mouth should be, is there anybody else in the family diagnosed with? Because where do you find the girls? They're often the sisters of the boys diagnosed with ADHD. They are the daughters of the adult diagnosed with ADHD. So look at it from a family perspective and it'll become clearer that you're probably dealing with both.
There are so many great questions about basically helping your child with executive functioning, all of that stuff. And I feel like we have some wonderful resources that I'd love to share with everyone afterwards. Um, I do want to get to the women component, and I do want to address real quick though. A lot of people asked about like getting properly diagnosed. I think it really is finding a center and a provider that understands this. I mean, again, Dr. Nadeau has researched this for so long, and we know that there are so many things that are overlooked. And so at our center, we specialize in this. People have asked about medication. There are so many new medications. It's about finding the right dose, all of that. So we'll share some additional resources on that too. And potentially do another talk because again, there's some wonderful questions and it brought up a lot more. But I think we should maybe segue with the time and everything into women with ADHD. So thank you guys for all your questions so far.
Okay, and so I'm going to stop sharing this PowerPoint. And then I need to
Again, the questions just keep coming in. These are amazing questions. I think we could have done a Q&A for 2 hours. So,
I
so again, this is the start of probably maybe a
you
little bit of a
know
series or
I'm having trouble not sharing the girls' PowerPoint. Let me try again. Now this is the one I want to share. Fingers crossed. Yes.
okay. I think we are seeing it as not the full PowerPoint though.
Okay, we'll try again. My apologies. Um,
We can do it this way. It still works, but um,
hmm. Well, why don't we go ahead? Even if they see the ones on the side, that's not going to be any harm. I don't want to waste time with technicalities. And let's go ahead and dive in.
okay.
So, what are the big treatment issues for women with ADHD? Self-blame and shame. I would say in general that it's much harder to be a woman with ADHD than to be a man with ADHD. Uh, I could talk about this all day long, but it has to do with the mismatch of gender role expectations, that what we expect women to do is hard for any woman in this day and age when we're also expected to work full time and somehow raise children and manage households. But it's an utterly impossible task to do well and with ease if you have ADHD. And so we end up blaming ourselves. What's wrong with me? I see the women around me. I'm of the generation where we jumped in with both feet, just determined to do it all and be it all. Well, I do not recommend that to anyone. It's an exhausting path to utter depletion, putting that on ourselves. There's a hilarious book that came out a couple of years ago called The Unmade Bed. And it was written by a guy whose wife has a big job in television and he's a writer. He was going to stay home with the kids. And he was declaring his parameters. I'm not going to make the beds. You're just going to get right back in the bed tonight. Why should I make it in the morning? In other words, he was not laying all those impossible societal expectations on himself as a stay-at-home parent. And he didn't even have ADHD. So we need to do a lot of self-liberation. The thing about treating ADHD is I believe ADHD has more coexisting conditions than any other adult psychiatric issue by far. David Goodman, who's affiliated with Hopkins, has done research and has written that ADHD is among the top 4 adult psychiatric conditions, and by his estimation, it's number 2. And yet it has all of these coexisting conditions, which means as therapists, we need to know about darn near everything. And it's not so much a differential diagnosis. Is it anxiety and ADHD? Is it depression? It's very, very often both. So I won't even bother to read all these, but this is just the beginning of a long list of common coexisting conditions. And the thing for us therapists is that treating these coexisting conditions is different when it's in the mix with ADHD. Sleep disorders are different impacted by ADHD. Why? Because we have hyperactive brains and we have something called delayed sleep phase syndrome. In other words, our circadian rhythms are naturally out of whack. Most sleep disorder specialists don't even address that. Same with eating disorders. Eating disorders for women with ADHD also relate to impulsivity, relate to difficulty with meal planning and preparation. We really have to address all of these through the lens of ADHD. So I say that the way to think about our role as a psychotherapist treating a woman with ADHD is my job is to help you improve your cognitive functioning in every way I can think of, every way we can conceive of. That might include stimulant medication, certainly includes exercise. Nutrition hugely impacts how calm you feel if you've got a stable blood sugar level throughout the day. Sleep is enormous. Neurofeedback can be very helpful in calming down the brain, stress management, and also pragmatic problem solving. I mean, I've done so much work with women and just let's identify the biggest stressors in your life and how can we eliminate them or at least reduce them. Pragmatic problem solving. I call this therapeutic coaching because stress and ADHD go hand in hand. If I can help you lower your stress level, your brain's going to work better. If you can't change it, we can't change everything. We don't have magic wands to create ideal environments. Then you need to compensate for the struggles that you have. And that's through habit development, easier said than done. Of course, daily self-care, which we women aren't so good at finding time for, learning stress management techniques, coaching, all kinds of apps. I learned so much from my clients about all the clever ways they've found to try to manage themselves. And constructive problem solving. As I said, how can we reduce your stress at work? How can we undercommit so that you're not always in hair on fire mode? A big part of the work that we need to do as therapists is help our clients restructure their environments. Can we streamline their home environment? Can we help them streamline meal planning and preparation? Can we look at all the commitments that their kids are involved in, and either distribute the responsibility for them or cut them down. I think especially in this area where there's so many highly educated families that want the best for their children, it's astonishing how many after school commitments there are. And we're really not doing ourselves or our kids a favor to keep them constantly overscheduled. So a big part of what we do as psychotherapists is help people conceive of, understand what is an ADHD friendly environment. Um, and by that, a household that isn't fussy, that doesn't require a lot of carefulness or maintenance. I mean, I remember when I was 12, my best friend's mother had this very expensive white couch. And if you sat on it, she expected you to fluff up all the cushions once you stood up. That was not an ADHD friendly environment. And I was much happier if she came over to my house, where we had a family room where you could put your feet on the table or the couch and it didn't matter. Eliminate or delegate red zone tasks. I don't have time to go into this in any detail, but what I really encourage families to do is to talk about, plan, negotiate who does what based on what is a better match for your skill set rather than just loading more tasks, especially onto the woman in the family. Whatever is low stress is going to be good, and optimal constructive sources of stimulation. What do I mean by that? Women's ADHD brains need stimulation, and a lot of them stimulate themselves on social media, in which they then start feeling badly about themselves because everybody has become their own PR agency and they're seeing pictures of Caribbean vacations and perfectly coiffed hair when they're sitting there in the middle of mayhem. Women stimulate themselves by online shopping and buying things they can't afford. We stimulate ourselves by eating, which, as we know, evening eating is not good for our bodies or our health, and yet that's a common way for women to self-stimulate. Years ago, when Pat Quinn and I wrote the first book, Understanding Women with ADHD, we interacted with an eating disorder specialist in Toronto who had interestingly noticed that the women that absolutely didn't seem to respond to any of the help that they offered, when he went back and looked at them, all had undiagnosed, untreated ADHD, and that their night eating and binge eating was really impulsivity and stimulation seeking. And one of the things he actively did with them was help them find interesting evening activities that didn't involve eating. And that's when they began to be able to eat in a more healthy way and begin to lose weight. ADD friendly jobs and careers, so important. And I find so many women, because they haven't completed as much education as they might have, end up in less stimulating jobs that are really supporting other people that have higher level management jobs. Exactly the kind of job that's not good for us as a woman with ADHD. They're managing all the details of the person that they work for. It's so important for our families to be informed and supportive of us. And of course, we need the support of professionals. Julianne mentioned my last book was on older adults with ADHD, called Still Distracted After All These Years. And one of the things that I was so interested in finding out about, I interviewed 150 adults that had been diagnosed with ADHD. And one of the patterns that I've never read about before was that many of these adults had found highly satisfying, compatible relationships with a spouse after a very difficult, painful, explosive first marriage. And the common theme in all of them was that we're laid back, we accept each other, we support each other. That my spouse is just totally cool if, I forgot to thaw the chicken for dinner and we have to order carry out. They're totally cool if I forgot to get the laundry out of the dryer. They're just that they married someone much more laid back, tolerant, and accepting, which is very often not what we seek the first time around. A lot of women with ADHD seek the structure and support of somebody who's efficient and organized, and then that efficient and organized person becomes very frustrated with us because we're not efficient and organized. There are many other, we certainly don't have time to go into it, but there are many other helpful interventions for women with ADHD, couples therapy. I am a huge proponent of group therapy for women. Why? Because it helps us find our tribe. For many women that come to our center, it's the first time they've ever been in a group of women that get them, that appreciate them, that accept them. What an incredibly therapeutic experience. So, taking charge of our own ADHD, I wrote a book called ADD Friendly Ways to Organize Your Life. And the 3 S's of that book are structure, strategies, and support. And we can give people all the strategies in the world. Go home and try this, go home and try that. If they don't have the structure and the support of others around them as they try to implement that strategy, it's not going to work. We're so hard on ourselves as women, and we're very good at blaming ourselves, at internalizing it. That's why we need to be in a group of women that can laugh about the foibles that we encounter every day. When my now middle-aged daughter was in college, we used to sort of have a joke of the day. What was your ADHD foible of the day? And she went to UNC Chapel Hill, and I think that they support the city by giving parking tickets to college students. But Franklin Street is the main drag through campus, and she had parked on Franklin Street. She had to run into some store. I don't remember what it was. And she said, so I found a legal parking space. I put money in the meter. I knew what time it was. I ran in, I ran out, and I had a ticket. And I said, what happened? And she said, I put the money in the wrong meter. So you just got to laugh. And it's so important to have people around you that can laugh with you and have had similar experiences. Educate those close to you. Not all of us are lucky enough to be married to or related to people that are open to being educated, but to the extent that we can, it's really important. It's only spilt milk. And I want to share with you that this slide for years said it's only split milk, because that was one of my ADHD foibles. It's only split milk, so don't worry about it. Okay, how are we doing in terms of time?
We are right about at 1 o'clock, and we are going until 1:15. So, yeah, I don't know how many slides you have left, but we definitely have a few minutes to wrap up this
Okay.
place.
Well, it's so important to help our clients, to help ourselves create an ADD friendly social world. So important to not hang out very much, if we can help it, with relatives that put us down, that tease us, that disparage us. Same way with friends. We really need to look for people who understand and appreciate us. Support groups, if you can find one. ADA is a great organization. They have online support groups for women, completely free. I strongly recommend them. Build in daily time outs. I remember teaching my daughter from the time she was a toddler that mommy needs quiet time. Mommy needs quiet time. And I just wanted a few minutes of peace and quiet. I'd been busy all day. And she really got that. And we were at my aunt's house near Baltimore for a big family party. And my aunt was going in the kitchen and shutting the swinging kitchen door. And she opened the door. She must have been about 4 years old. And she said, "Do you need quiet time?" So she really got that concept. Avoid burnout. We're so prone as women to just push ourselves until we can't go anymore. There's a theme here that I hope you're all getting, that we put too much on our plates and then feel terrible about ourselves if we can't deal with all the stuff that we've put on our plates. And last but not least, focus on the things you love. We forget to do that. We're so busy scrambling to take care of and manage everything that we don't really give ourselves enough time to savor the moment, to feel good about something we've done, to have a calm and supportive interaction with others. So let's dive into questions. And of course, we have a quadrillion other things we could talk about. So,
Yes. And I just want to quickly comment as someone who is an older or a female who was diagnosed later in life, in my 30s, I have learned so much just from all of your talks. And I feel like the things that I always remember that stick out from things that you've said are how you talk about when women first come to you for consults or, at our center. And the one common word that they use is overwhelm. Like, I'm
overwhelmed.
just overwhelmed. And, there's just so much shame associated with this and so many feelings. And it's like the societal pressures, it's all of this stuff. And I don't know. I've learned so much from that in terms of practicing what you preach a little bit. But example, as a new mom as well, I follow these accounts called Type B moms. They're not Type A moms. So all my social media accounts are Type B moms, and we talk about all of our things that we mess up and things that we forget to do. And anyway, so
I think that's great.
yes, but the peer support component. Okay, again, a lot of questions, and we're going to follow up with more specific answers. But the general themes that I'm hearing are, can you talk about the impact of hormones on women and kind of just ADHD for girls and women?
Oh, yes, that is a hugely important and complicated issue. However, I think we really did women a disservice years ago when we had this gigantic scare about hormone replacement therapy and how dangerous it was. Cancer, cancer, don't do it. And it was a gross exaggeration of the risks, while completely ignoring that we women actually need functional brains, that hormones help us regulate our emotions, hormones help us think clearly. And the only thing they looked at in that study was protective heart issues versus breast cancer. They didn't even look at, we women have brains that are hugely impacted by hormones. They did an interesting study right at the time of our panic about hormones. They asked all the female physicians in the UK medical system, asked if they themselves, if they were menopausal, postmenopausal, did they take hormone replacement therapy themselves, because they were the best informed about the benefits and risks, and almost all of them did. So yes, it's very important. In fact, we are hoping to bring on a hormone specialist to our clinic for that very reason, that I think the consideration of hormone replacement therapy should be an integral part of treating women with ADHD. It's not a one size fits all. And yes, indeed, there are a number of women, but it's very much in the minority that cannot take hormone replacement therapy because of breast cancer risk. But most of us do not fall into that category. We're learning more and more about it. And I think we in the United States are really far behind what's been going on in Canada, the UK, and Europe in terms of hormone replacement. there's a wonderful trio of three female physicians in the Netherlands. One's a gynecologist, one's a cardiac specialist, one's a psychiatrist, and they have formed a triumvirate to treat women with ADHD and talk about the importance of hormones. So yes, very complicated issue, a lecture in and of itself, but an important part of treatment.
Late diagnosis. So we have a lot of people who've commented about either is it too late to pursue a diagnosis or I was just diagnosed. What do you have to say about that, about a late diagnosis? Why is it important? And
Oh,
also with your book.
absolutely. I think no matter what your age, a diagnosis is so important. And a good diagnosis should be able to be made with just a lengthy, detailed clinical interview that looks not at only at your history, but at your family's history. My own husband, when I started many years ago working on the book on older adults, said, because he's not a psychologist, why does it matter if you have ADHD when you're older? And I think that kind of ageism of you don't need a brain when you're older. Why would you need a functional brain? Well, what happens is that when we enter retirement years, we undergo a lot of the same challenges that our kids experience as they leave home. Now, that may sound odd, but what they have in common is we lose the structure and support of our workplace. We've lost the structure and support of our children's activities. Sometimes we lose our spouse. And I have worked with a number of people that were just completely lost. They'd gone through a late in life divorce, or they had lost their spouse, and they were leading isolated, depressing lives and very unhappy about it and not knowing how to get out of that. They'd lost all the connections that they'd had in life. So yes, indeed, get yourself diagnosed, get in support groups, learn from other adults. We still need our brains. Life is complicated in older age, whether it's just keeping track of prescriptions and doctor's appointments and payments and taxes and retirement. I mean, there's a lot to keep track of. So we need our brains, and it's helpful at any point in our life to really understand what's going on and how we can change it.
And as many of you have said in the chat, it's very validating of, okay, this is not just me. And this is something that I can, find my tribe. Someone mentioned starting a WhatsApp group with everyone in this chat. And I feel like we should. There's so many great questions.
Absolutely,
Yes.
absolutely. We can learn so much from each other. Years ago, I ran a CHAD adult support group in Montgomery County. And one of the things that struck me is I learned a lot from the people in the group about approaches that hadn't occurred to me. I mean, so there really is help in numbers. And so great, form a group. I'm all for it.
Yes. Again, I'm trying to kind of group the common questions, and I think there were so many wonderful ones, but career satisfaction has come up many times in terms of what types of careers are good for ADHD. We do offer a career assessment that Dr. Nato actually developed that helps you pinpoint this, but just generally, what should we look for in terms of a career for someone with ADHD? What do you have to say to someone who is dissatisfied in their career or feel burnt out?
Okay, well, there are a lot of different factors to consider. I have worked with people on career issues for decades. One of the things is there enough structure and support in your job? I remember working with one young woman who was working for a nonprofit, and she was just lost and felt I'm not accomplishing anything. I feel badly about myself. It was because she had a remote supervisor who really wasn't doing his job. And I told her, let's look for another nonprofit in town that's hands-on, that you'll have a cohort of people to interact with, that you'll have an on-site manager. She did that, and she was immediately happy. That was the factor that was missing for her, was structure and support. The other thing that so many women find themselves in, I mentioned this earlier, is they end up being the support for someone else. And I can't tell you how many women have come to me saying, I think my boss has ADHD, untreated ADHD, and my boss is expecting me to keep them organized when I have ADHD. So we end up with this double whammy of we're supposed to manage our households, we're supposed to manage our boss. That's not an ideal um, circumstance for a woman with ADHD to be in. In terms of what's a good job, there's enormous variation among us, but I find that a lot of isolation isn't good for us because all that structure and support is missing. It certainly needs, ideally, to be something we care about. I love my work. I don't have to get up and, tell myself, get in there, you've got work to do. I am very motivated to do it. To the extent that we can find something that we care about, it'll make all the difference in the world. The ADHD brain is driven by, it's an interest driven brain. We can't force ourselves to be interested in something. We are drawn to things. Find what you're drawn to. And it's not necessarily one single thing. It may be that I'm drawn to a job where I get to interact with people all day, or I'm drawn to a job where I work on a small team that gives me the structure and support I need to keep moving forward. I remember working with a guy who was in technology. He did all sorts of computer work, and he worked for a small firm in Alexandria where he was just working solo, kind of at his computer in the back. And the more I talked to him, I said, what would you rather be doing in this firm? And he said, I would love to be working with the new hires. I like to teach. I like to interact. He asked his boss to change his duties, and all of a sudden he was one of their most productive employees because he was doing what was a natural fit for him. So it's not that, in a way, if it's uninteresting, it's not a good match. If it's too detail oriented, it's not a good match. If there's no structure and support, it's not a good match. But we're all so different as people with ADHD that the real key is to find something that we're naturally drawn to and care about. And then a lot of other things can fall into play.
I'm just loving this chat. So we're starting a WhatsApp group. Someone also started a Facebook group for us. Someone commented that they went back to the office because working from home and seeing the clutter was not for me. And then someone else said that they actually work from home better because they don't hear everyone on the phone around them. So this is great. I mean, this is what it's about. It's finding what works for you.
Absolutely.
And wow, just do you have any final things to say about this? Again, so much was covered. We have so much follow up. We're going to review everything and um, definitely think about doing, a part two to this. But what else would you like to say to any of the women, mothers who have ADHD, mothers who don't have ADHD, who are parenting daughters, all of the above?
Well, I have one very strong message to convey to all of you, and that is, when we talk about it, it's this disorder, this awful disorder. I mean, can you imagine a group of women with anxiety disorders rushing around? Let's form a group and be anxious together. Would never happen. How about women struggling with depression? Not going to happen. When I've gone to ADHD conferences, it's almost like a party of women just so excited to be around other women. I ran a focus group at a conference a number of years ago, and there must have been 50 women just sitting in the room, and I was facilitating, and they were talking, and they were having such a good time. It's finding your tribe. It's finding the place where you belong. And I think that one of the painful aspects of growing up with ADHD is people around you and you doing it to yourself, trying to conform to things that just don't suit you. And once, just in this online meeting, you found each other. I ran a group for moms with ADHD at our center just one time. And they immediately said, let's do this again. This was great. Let's do it. When we find each other, there's so much energy and connection and support that's very healing and productive.
Thank you. And thank you, everybody. You are living proof of the importance of your work. We just got that comment, and I could not agree more. So thank you, Dr. Nato. Thank you, everybody, for attending and for your engagement. This has been the best response in chat that we've had one of these Ask the Experts. So um,
That's because it's a group of women with ADHD.
yes, truly. I mean, this could not be more of the proof that we're looking for in terms of what you're saying to us. So, thanks everybody. We will be sending all of this out. If you have ideas for future topics, let us know. I put my contact information in the chat, but also I will send that. It will be me that's sending it out, so you'll be able to talk to me. And Dr. Nato, thank you again for everything that you do and for joining us today.
My pleasure.
All right. Bye, everyone.